Welcome to This Week in Radiology. This week we're covering 10 notable papers spanning major updates in neuroradiology, new guidelines and classification systems for body and interventional radiology, and advances in pediatric imaging. Let's dive in. We begin in neuroradiology with a major focus on acute ischemic stroke. A review in AJNR American Journal of Neuroradiology provides a guide for radiologists on the 2026 AHA, ASA guideline for early management of acute ischemic stroke. While foundational recommendations remain, the update introduces expanded guidance for medium vessel occlusions and for the first time includes specific pediatric recommendations. These changes will directly impact imaging workflows, making this a crucial read for any practice involved in stroke care. While guidelines expand treatment eligibility, a post-hoc analysis of the tension trial, also in AJNR, explores the challenging clinical question. Why do many patients with large infarcts have poor outcomes, even after successful endovascular reperfusion? The study looked at 110 patients who achieved successful reperfusion, defined as a TICI score of 2B or greater. Despite this, a majority, about 62%, had a poor functional outcome at 12 months. The analysis found that pre-treatment factors associated with a poor outcome included a higher baseline NIHSS score, longer time to recanalization, and interestingly, the administration of IV alteplase, which was associated with a more than four-fold increase in the odds of a poor outcome. Key post-treatment factors were a high NIHSS score at 24 hours, a larger final infarct volume, and the development of pneumonia. These findings highlight that successful recanalization is only one part of the puzzle for patients with large core infarcts and suggest that factors like baseline severity and post-procedure complications play a critical role. Adding to the discussion on stroke therapeutics, a commentary in The Lancet addresses the limitations of the Emphasis trial, which investigated minocycline for acute ischemic stroke. While the abstract was not available for review, the title suggests a critical appraisal of this trial's evidence. Rounding out our neuroradiology section is a comprehensive review from Radiographics on the neurologic complications of varicella-zoster virus, or VZV reactivation. The authors emphasize that severe complications like vasculopathy, encephalitis, and myelopathy can occur even without the characteristic skin rash, making diagnosis difficult. MRI is the most useful imaging modality, and the review highlights the value of newer techniques like vessel wall imaging to demonstrate vascular involvement directly. A key message is that radiologists may be the first to suspect VZ-related neurologic disease, and integrating imaging findings with CSF analysis is essential for a timely diagnosis and initiation of antiviral therapy, which is critical for improving patient outcomes. Next, we turn to two papers focused on specialized imaging, particularly in pediatrics. A study in AJNR presents a potentially practice-changing protocol for pediatric neuroimaging in the emergency department. Given that long MRI acquisition times often lead to motion artifacts, the need for sedation, or the use of CT with its associated radiation, the investigators evaluated a fast, 2.5-minute multi-contrast sequence called NeuroMix. In a finding-enriched cohort of 100 pediatric studies, this rapid protocol was found to be diagnostically interchangeable with a standard 15-minute emergency MRI protocol for detecting clinically relevant intracranial findings. The diagnostic accuracy was identical between the two protocols, but the NeuroMix protocol had a median acquisition time of just 2.7 minutes compared to over 15 minutes for the standard protocol. It also resulted in fewer motion artifacts and fewer repeat sequences. These results support NeuroMix as a fast radiation-free alternative for neuroimaging in the pediatric emergency setting. Also in the pediatric realm, Radiographics provides a valuable review of the imaging spectrum of childhood interstitial lung diseases, or CHILD. These rare disorders are often challenging to diagnose due to non-specific clinical symptoms. High-resolution CT plays a central role. The authors detail the imaging patterns, noting that the acute phase often presents with centrilobular ground glass opacities or a crazy paving appearance, while chronic changes include reticulation, lung cysts, and honeycombing. The review stresses that while individual findings are non-specific, a meticulous integration of the complete imaging picture in a multidisciplinary context with clinical and genetic data can often lead to a specific diagnosis and improve outcomes for these children. Our final theme this week covers new classification systems and practice guidelines. In Radiographics, a review details the imaging features and clinical implications of the 2022 World Health Organization classification of renal cell tumors. A major change is the reclassification of what was formerly known as papillary renal cell carcinoma type 2. These tumors are now distributed into new categories, including other renal tumors and molecularly defined renal carcinomas. For radiologists, the key takeaway is that many of these newly defined rare tumors demonstrate gradual enhancement similar to papillary RCCs. However, careful evaluation of other features, such as patient age, tumor homogeneity, T2 signal intensity, and non-enhanced attenuation, can raise suspicion for a rare subtype. This is crucial for guiding urologists on surgical strategy and helping pathologists select the right tests for a definitive diagnosis. Sticking with oncologic imaging, a study in European Radiology investigated how to improve the diagnosis of axillary lymph node metastasis in breast cancer. The researchers found that the Standardized Node Reporting and Data System, or NODE-RADS, provides a reliable method for assessment. They also demonstrated that combining the NODE-RADS score with the apparent diffusion coefficient, or ADC value of the lymph node, significantly improves diagnostic performance. A predictive model incorporating both NODE-RADS and a calibrated ADC value showed excellent predictive ability, with an area under the curve around 0.8 in both internal and external validation sets. This combined approach offers a simple and practical tool to help formulate personalized treatment strategies for patients with breast cancer. Finally, we have two new sets of practice recommendations. First, from the Journal of the American College of Radiology, new ACR appropriateness criteria are available for the common clinical problem of epigastric pain. These evidence-based guidelines cover a wide range of pathologies, from GERD and peptic ulcer disease to hiatal hernias and post-surgical complications, providing a systematic framework for choosing the right imaging test. Second, a multidisciplinary practice parameter from several societies, including the ACR and SIR, has been published in AJNR regarding the performance of image-guided epidural steroid injections. The document reinforces that these procedures should be performed with image guidance to maximize safety, particularly given the rare but serious neurologic risks. It provides recommendations on patient selection, contraindications, and technical execution, emphasizing that these injections should be part of a comprehensive, multidisciplinary pain management plan and performed only by appropriately trained physicians. If you only have time for one paper this week, make it the study on the 2.5-minute brain MRI protocol in the pediatric emergency department. This paper directly addresses the common and vexing problems of long scan times, sedation needs, and radiation exposure in acutely ill children, offering a validated, rapid, and radiation-free alternative that maintains diagnostic accuracy. Here are the key takeaways from this week in radiology. First, in stroke care, new guidelines are expanding criteria for endovascular therapy, while research is providing a clearer picture of why patients with large infarcts may have poor outcomes despite successful reperfusion, pointing to factors like baseline severity and post-procedural complications. Second, a new 2.5-minute brain MRI protocol for pediatric emergencies is diagnostically equivalent to a 15-minute standard protocol, offering a way to dramatically reduce scan time, motion artifacts, and the need for sedation or radiation. Third, the 2022 WHO classification of renal tumors has redefined several entities. Radiologists can help guide diagnosis by identifying atypical imaging features in tumors that might otherwise be classified as simple papillary RCCs. Fourth, for breast cancer staging, combining the NODE-RADS classification with ADC values provides a robust standardized method to improve the prediction of axillary lymph node metastasis. Finally, updated practice guidelines are now available to standardize the workup of epigastric pain and to optimize the safety and efficacy of image-guided epidural steroid injections. That's your roundup for this week in radiology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.